Hi there. Are you worried about a mass on baby's belly button? Well, it might be an umbilical granuloma. Today, in this Ask Me Anything episode, I answer your 10 most common questions about umbilical granuloma. Before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you, moms and dads, so you can raise happy and healthy kids. Welcome to our Ask Me Anything episode for today. Now let's get started. The first question: what is an umbilical granuloma? Well, it is a growth of tissue that develops after baby's umbilical cord has fallen off. It is found in baby's belly button or navel. Then, what causes umbilical granuloma? Well, an umbilical granuloma may develop after the normal process where the umbilical cord has fallen off, and if it has not completely dried up, an umbilical granuloma may form. It usually happens when the healing has been disrupted. Now, how is an umbilical granuloma diagnosed? Well, the diagnosis of an umbilical granuloma is through physical examination. The doctor will examine your baby's belly button or navel and would note a fleshy mass of tissue and would immediately and your doctor can immediately tell that it is an umbilical granuloma. Are umbilical granulomas painful? So typically, umbilical granulomas are not painful. They are more of a cosmetic concern that the appearance does not look too good and parents are worried about it. But typically, it doesn't hurt for babies. What is the treatment for umbilical granuloma? Well, if your baby has an umbilical granuloma and you're worried about it, it is better to bring to your pediatrician. The pediatrician may apply a chemical known as silver nitrate, which would cauterize and shrink the umbilical granuloma. Well, in some areas where this is not available, my advice to you is to keep the area dry, most especially. And you can apply a rock salt on baby's umbilical granuloma, leave it on for 10 minutes, and then wipe it off. And then do this every day until the umbilical granuloma has completely healed. It is best that you keep the area dry. Can umbilical granulomas lead to complications? Well, most often than not, umbilical granulomas are typically benign and would not lead to any complications. In some rare cases, when they are not completely healed or not completely treated, some complications that may arise might be from an infection or there might be some bleeding. But of course, like I mentioned, these are rare. When should you worry about your baby's belly button? You should worry if the skin around baby's belly button is red, there is pus coming out, there is a foul smell, if baby has a fever. These may be a sign that your baby has an umbilical cord infection and not simply a, an umbilical granuloma. You should also worry and let your doctor know if there is persistent profuse bleeding from the area. All right, how common are umbilical granulomas? Well, they are relatively common and can occur in a small percentage of babies. That umbilical granulomas typically you should not worry about those because this is simply a benign condition. All right, when should parents seek medical attention for an umbilical granuloma? So you should let your pediatrician know if there is an abnormal growth in your baby's belly button, if there is persistent or profuse bleeding, or if there are signs of an infection. As I've mentioned, If the skin around the baby's belly button is red, baby has a fever, there is pus coming out, or there is a foul smell, you need to tell your doctor about it. And um, can umbilical granulomas be prevented? Well, there is no guarantee that uh, whatever, however best you care for your baby's belly button, some cases, some babies may still have umbilical granulomas. Rest assured, though, that this is a benign condition, and seek help from your pediatrician. Take note, these are general guidelines for umbilical granulomas. If you are worried or there are signs that, as I've mentioned, that you should watch out for, then it is best that you bring to your pediatrician. Hey, if you like this episode, watch my next video where I teach you about other child health problems.